Is Obamacare the answer to our healthcare problems here in the United States? Let's answer that question here at Dr. Deane's webinars on healthcare. For those of you who don't know me, my name is Deane Waldman. I'm both a physician and have an MBA, professor of emeritus in pediatrics, pathology, and decision science. Currently, I serve on the New Mexico Health Exchange Board of Directors. And possibly most important, I wrote a book which I urge you to read called The Cancer in the American Healthcare System. This is one of a series of webinars about healthcare with titles such as What's Really Happening in Healthcare? Should I buy health insurance or not? What would a good doctor do for healthcare? Today we'll talk about, is the Affordable Care Act, or Obamacare, the answer? We'll also discuss in another seminar, single payer and other fantastical beings, and I will offer you a proposed cure for our healthcare system called Direct Pay USA. Today, we'll be talking about the Affordable Care Act, which is really an ever-changing law, both in name and focus, as well as in the law itself. We'll discuss what's wrong with our healthcare system. We will discuss the promises versus the evidence of effect for Obamacare in order to try and answer that title question. And then, of course, we must answer, with the Affordable Care Act, is our healthcare system better or worse? And is your healthcare service better or worse? And finally, based on all of the above, what should you do? The Affordable Care Act has been an ever-changing law since both before and after it was passed on March 23, 2010. Its name was H.R. 3590, then it was the Patient Protection and Affordable Health Care Act, then it was PPACA, Patient Protection and Affordable Care Act. Now it's abbreviated to the Affordable Care Act alone, or just Obamacare. The president actually spoke eloquently before passage and signing of the law about reforming health care, but after the law was passed, he confessed that he was really talking about reforming health insurance. This law has had 54 major changes at the time of this dictation, most of them, frankly, by executive order, which, of course, the executive branch of government cannot change what Congress writes as law, but nonetheless, the White House has done so. Actually, much worse, there have been tens of thousands, at least, rule changes over the past 5 years. In case you don't know, the original set of rules for the Affordable Care Act took over 10,000 pages in the Federal Register, which translates roughly to 20 million words of rules, and then they have been changed over and over and over again. I can say that from personal experience because we get these rule changes on the board of the Health Exchange, and then we have to change what we did the week before because Washington has altered some rule or regulation or eligibility requirement, things of that nature. Now, what's wrong with our healthcare system in the broad sense? Well, of course, we have national overspending. We're just spending too much, and I'll show you that. Our health care is unaffordable. Our health care is inaccessible, even ignoring the cost of that care. Insurance, health insurance, is unaffordable. And then, of course, there is what the president called the stain on our national honor of having 45 million uninsured Americans. Spending in our country per capita. Here's a nice little graph, 2012-2013 data, showing that we are spending much more than any other nation. In 2013, we spent an average of $8,713 for every single person in our country. That's 320 million Americans. In 2014, that number was $10,300 when the Affordable Care Act actually started being implemented. As you know, it was passed in 2010, but only was implemented and affected us starting in January of 2014. Now, if you look at U.S. spending as a percent of our total gross domestic product, you'll see again that we are spending considerably more than any other nation on earth. In 2008, the United States spent 16% of our gross domestic product on our healthcare system. In 2014, with the implementation of the Affordable Care Act, that number had increased to 18.9%. There is considerably more about this in The Cancer in the American Healthcare System, and I urge you to read it. Let's talk about care and wait times. This was a cartoon that came out when the VA debacle became front page news on every newspaper in our country. That was in 2014. This is a joke that, frankly, is not funny at all because of what it's done to our veterans. And this year, earlier, in 2015, the Veterans Administration itself issued a report showing, quote, 307,000 veterans may have died while waiting for approved health care. Now, that's more than all the soldiers who died in the wars in Iraq and Afghanistan, waiting for approved care. Then, if you're not a veteran, you've got your own wait times. Yes, the clinic is open, and you sit and you wait and you wait. And frankly, the emergency room is also open, but you wait and wait. There was a newspaper article in our local paper showing that the average wait in the University Hospital emergency room was 11 hours. In a state that had a precursor of the Affordable Care Act, namely Massachusetts with Romney Care, data shows that a woman who has an abdominal complaint, a new concern in her abdomen, will wait 48 days before a physician will see her. I dread to think what the data will show when the Affordable Care Act really has taken effect in 2016 or 17, how long we're all going to wait for care. Let's talk about inaccessible care and insurance status. What if you don't have insurance? Well, you can't get routine care or preventative care. It's hard to impossible to get outpatient services, whether it's surgical or dental or occupational or physical therapy. On the other hand, because we have EMTALA, the Emergency Medical Transport and Active Labor Act, also known as the Anti-Dumping Law, you can get urgent or emergent care through an emergency room. Now, if you have insurance, you still face all those wait times that we mentioned earlier, but much worse, you have trouble accessing a doctor, finding one who will actually care for you. What you see or experience are closed panels, no doctors in your area at all, and many doctors are refusing to accept Obamacare insurance, or quite frankly, many doctors are just saying, we won't take insurance at all, and that is the rise of concierge medicine, or what I call direct pay medicine. Of course, if you have insurance, you still face all those co-pays and deductibles in addition to your insurance premium. Now, let's talk about care for a second. Care has been and continues to be unaffordable. Drugs. Sovaldi, the anti-hepatitis drug, costs $1,000 a pill. Daraprim used to be $13.50 a pill, and now is $750 for each and every pill. Well, let's not even think about surgery. My area, heart surgery, a transplant costs in excess of $250,000. Now, don't you wonder where all that money goes? And I'm going to leave it open, but I urge you to find out by reading The Cancer in the American Healthcare System. You will be surprised. Insurance. Well, insurance is unaffordable just like care is. Here's a graph that is in the book that I took from the Kaiser Family Research Foundation, which provides very good and reliable data on healthcare. Let me summarize it by saying in 1999, the average American family spent just over $5,700 on health insurance. By 2012, it was 3 times that number, $15,745, and in 2014, that number had risen under Obamacare to $18,900. Remember when the president promised us that his reform bill was going to save each family $2,500? Let's look at that again with some Kaiser data. In 2010, the actual cost average for a family was $13,770. If you simply take off $2,500, the promised savings, then the cost should have been under Obamacare $11,270. In fact, that year, which is 2013, it was $16,350. In other words, what they called the Obama credibility gap was $5,000 that it cost us, even though we were supposed to save $2,500. And then, of course, there is the uninsured. We have the legal, that is, documented citizens who don't sign up. Now, firstly, there is a large percentage of people who are actually eligible for free insurance, Medicaid, but they don't sign up, and there is a question as to why. There are people who are not poor, but they still can't afford health insurance. If you're making $50,000 or $60,000 a year, you're not classified as poor, but you sure as hell can't afford $18,000 of your total income just for health insurance. And then, of course, there are all the young invincibles who just don't think they need it and don't want to sign up. Of course, then, for those who do sign up, there is what is known as sticker shock. Those copays, the premiums are rising, the deductibles that you get hit with. These are all a shock to you when you think you've covered yourself for the cost of health care. Undocumented or illegal people within our country. You may remember that the president started this whole discussion after he talked about national overspending with a stain on our national honor of 45 million uninsured Americans. That was a number that came out of a GAO report, and his statement about 45 million was, a day or two after the report came out. Somebody eventually, in the next couple of weeks, read that report and reported to him that of the 45 million, 13 to 15 million were uninsured, were undocumented Americans, and he sure as heck didn't want to get into that discussion. So you will notice, if you watch subsequent reports of the president's remarks on healthcare, that he talked about 30 to 32 million uninsured Americans, neatly ignoring the undocumented or illegals. Now, illegals are not eligible for government-supported insurance, Medicaid, CHIP, and so forth. Yet, the Affordable Care Act, if you read the regs, and I have been forced to, being on that health exchange board, you will find that there is ambiguity. You might be eligible if a family member is actually a citizen, but you are not. There are contradictory regulations built into this. The fact is, it is open to interpretation by whoever wants to, and eventually will get to the courts. Most important, our nation has never formed a consensus about care for illegal people, residents here in our country. In case you don't know this, in the universal health care countries such as Germany and Great Britain, if you are not a legal citizen, you don't count. You don't get government-supported care. So it's not quite as universal as people think. Let's talk about promises versus reality. What were the promises made for the effects on us of the Affordable Care Act? Well, it would cut national spending. That was number one. If you recall, candidate Obama in 2008, before that election, promised that his health care reform, quote, would not be financed by taxes on the middle class, end quote. So one of the promises was no taxes on the middle class. Of course, we have the stain of the uninsured. We have health care for all Americans. You recall, if you like your doctor, you can keep your doctor. If you like your insurance plan, you can keep it. And finally, the Affordable Care Act was supposed to make insurance affordable. What actually happened? What is our reality? Well, the Affordable Care Act generates new spending of $2.6 trillion. The Affordable Care Act contains 12 new taxes, mostly indirect taxes, that you don't see on your tax bill, but you still pay, and 4 taxes that were increased. The uninsured, their numbers did go down so far by 2.5%. However, virtually all of that is through, quote, free, end quote, Medicaid expansion insurance. And you know that there is no such thing as free. You and I pay for it. Care for all Americans. Well, what about undocumented residents? What about our illegals? If you like your doctor, you can keep your doctor. Well, you can't keep either your doctor or your insurance. In the first year of implementation of the Affordable Care Act, which is 2014, 7 million Americans had insurance that they liked and lost it. And finally, make insurance affordable. Well, premiums went up an average of 20, depending on the state, to 149%. So what was unaffordable before is now even more unaffordable. Let me say this as a physician. Healthcare is much more than just a game. It may be a game to Washington, but it isn't a game to our country where it directly affects all parts of our society. Money used for healthcare is money that can't be used for education, for infrastructure, for the military. And of course, healthcare affects us as individual Americans, we the people, or as I like to call us, we the patients, since the one thing we have absolutely 100% in common is that we all need healthcare now or will need it in the future. So, the answer to the title question, Obamacare has made healthcare, our system, as well as healthcare, the service, worse, not better. Obamacare is not the answer. Now, what should you do? What are your next steps? Because you need to do something to protect yourself and to help your family. Number one, I urge you to visit wecanfixhealthcare.info, not .com, .info. Consider for yourself the information on the website. Don't trust anybody else. Trust yourself. Don't just listen to what the politicians say. Listen to what your mind says. Look at the other webinars that are available. The titles I mentioned earlier, here they are again. As you can see, they are things you need to know about and consider. And finally, I urge you to read The Cancer in the American Healthcare System. Thank you.